Now, as an economist, I can't give you silver bullets, but reforms into mental health interventions in the workplace are pretty much as close as we're going to get. Yeah? Let me give you some statistics. The difference in productivity between someone who has a mental illness compared with someone who doesn't ranges between 4 and 9%. What does 4 and 9% mean? Well, it means every fortnight you're looking at around half to a day worth of productivity due to mental illness. Think about that for a second, that's huge. In absenteeism, the rates are even worse. So people with mental illness are absent from work at around 2 to 5 times the rate of someone who doesn't. So typically in health, we actually pay money to achieve better health outcomes. Think of the investment that we make in pharmaceuticals, yeah, to come up with new drugs that might offset, some cancer down the track or heart disease. Knee and hip surgery, $20,000 or $30,000, yeah, to reduce pain and increase quality of life. We're happy to pay to achieve health outcomes. Well, these interventions not only achieve the health outcomes, but they also deliver economic benefits as well. In the health economics jargon, there is a specific term for it. It's called a dominant intervention. Yeah? Because not only do they deliver better health outcomes, but they deliver better economic outcomes as well. They're win-win interventions, they're no-brainers. The economic costs and the human and social costs are really aligned. There's no economic costs here if there's no human costs. Or to put it another way, the reason that we see such high returns to these high economic returns to these interventions is really simple. It's because of the human cost of mental illness. And anyone who's experienced mental illness themselves or had a colleague or family member experience mental illness can attest to this. We're really proud of our report. We think it makes a really significant contribution to the debate, and we think it's compelling in showing the economic returns that are available from really choosing wisely in terms of how we spend our healthcare dollars. And we're hopeful that this, that this report's going to lead to both a more mentally healthy population as well as a more productive one.